Hi everyone, so we're talking about Huntington disease today. It's very important. You need to understand that it starts with Hunt, right? So Hunt and then Huntington disease. Whenever you're talking about a disease, you have to also pay attention to its pronunciation as well as the spellings. So that's the reason I'm breaking it down for you. Huntington disease is an autosomal dominant inherited disease, and usually it starts showing its onset or its symptoms after the a- age of, let's say, a person is in the late adulthood. So in the adult life, mostly the symptoms are shown, and it's so late because the person has already had kids, and since it's an autosomal dominant inherited disease, so there are great chances that this will also appear in the kids. And also, death occurs within 15 to 20 years after the onset, sadly enough. Now, this is a single gene defect. So it's basically a single gene mutation disease, and this disease occurs primarily on the chromosome 4 because chromosome 4 is responsible for coding for this protein called Huntington protein. And now, what happens is basically there's already a video recorded about the trinucleotide repeat expansion. So in that, you'll realize that trinucleotide repeat expansion, basically what happens that in the coding region of in the DNA, there are multiple repeats of CAG codon. So when the multiple repeats of CAG codon, this codes for glutamine. So there'll be a lot of glutamine, more than 36, because of which obviously the protein is going to elongate a lot, and then it will sort of form aggregates, and those are going to be neurodegenerative. So this is how the disease progresses. So this was the biochemistry aspect of it. When you talk about the before moving to the physiological aspects of it, let's talk about its symptoms and all of that. So the disease affects men and women with equal frequency and unfortunately often reveals itself only after they've had children. Now, these are the symptoms, very important. You just need to know choreiform movements and progressive dementia. So there are choreiform movements as well as progressive dementia. These are the two features. So if anyone talks to you about Huntington disease, first thing first, you need to know about it being autosomal dominant, right? And then also that this is basically repeat trinucleotide repeat expansion, and there are multiple repeats of the CAG that encodes for glutamine. Enough. Then you need to talk about choreiform movement and progressive dementia. So basically, there are involuntary movements of the extremities and twitching of the face. So basically, there'll be facial grimacing, right? Later, more muscle groups are involved, so the patient becomes immobile and unable to speak as well as swallow. Now, progressive dementia occurs with the loss of memory and intellectual capacity. So, if anyone talks to you about dementia and asks you what is dementia, it's basically progressive loss of memory as well as intellectual capacity. So, in this disease, Huntington disease, there is choreiform movements, basically rapid involuntary movements of the extremities, and there'll be twitching of the face, like grimace, like the person will be making grimaces involuntarily. And also there'll be, what do you call it, muscle groups will also be involved, which means that the person will be unable to speak or maybe even swallow, and there'll be progressive dementia that will there'll be loss of memory as well as loss of intellectual capacity. In this disease, the GABA secreting, substance P secreting, and acetylcholine secreting neurons of the striatonigral inhibiting pathway degenerate. This results in dopamine secreting neurons of substantia nigra becoming overactive. Very important. So this is basically the anatomical as well as the physiological aspect of it. So the GABA secreting, substance P secreting, and acetylcholine secreting neurons, they degenerate, whereas dopamine is secreted in excess. So this is something you need to know. GABA, acetylcholine, and substance P is decreased, whereas dopamine is increased. And now dopamine is associated with the movements, involuntary movements. So because there's a lot of dopamine, there'll be a lot of involuntary movements resulting in choreiform movements. So yeah, becoming overactive, the nigrostriatal pathway inhibits the caudate nucleus and putamen. Very important. In this, what happens is because of excess dopamine, the caudate as well as putamen. So caudate nucleus and putamen will be inhibited. So these two words also you need to know. This inhibition produces the abnormal movement seen in this disease. CT scans show enlarged lateral ventricles due to degeneration of caudate nuclei. Medical treatment of the Huntington chorea has been disappointing. So there has not as yet been any medical treatment. But yeah, as the medical world is advancing, let's hope for its treatment as well. So Huntington disease, this is what it means. Let's just recap and then I'll explain to you from other aspects as well. Huntington disease, it is an autosomal dominant disease, right? Now, what happens is that there's trinucleotide repeat expansion, CAG, it repeats multiple times because of which there's a lot of glutamine. Now, when there's a lot of glutamine, the protein, what happens, it elongates a lot, and because of that, there are a lot of aggregates of it forming, and those result in neurodegeneration. Now, chromosome 4 particularly, so this is a single gene defect on chromosome 4 that encodes Huntington protein. Yeah. Now, the patient experiences choreiform movements and progressive dementia. What happens? Basically, GABA, acetylcholine, and substance P, they have decreased. What has increased? Dopamine. And also, because there's a lot of dopamine, caudate nucleus and putamen will be inhibited, and there'll be a lot more involuntary movement, in other words, choreiform. So this is Huntington disease. It's very simple. Here also you can see this. Huntington disease is a progressive inherited disorder of the brain that causes abnormal movements, psychiatric problems, and cognitive decline. So abnormal movement is basically the choreiform movement, whereas the cognitive decline is the um, what do you call it? Dementia, progressive dementia, and psychiatric problems due to mutation of the HTT Huntington gene with CAG trinucleotide repeat expansion. It is autosomal dominant, so if only one affected parent is there, they can pass it on. This is what autosomal dominant means. Degeneration mainly occurs in the basal ganglia, especially the caudate nucleus and the putamen that I have already told you. Now, main feature is chorea, psychiatric symptoms, and cognitive decline. So there is choreiform movements, and there is progressive dementia, and then you can also say psychiatric symptoms like depression, irritability, and behavioral changes. Usually, I told you in the late adulthood, so 30 to 50 years of age, and progressive worsening, weight loss, difficulty speaking, and also swallowing. Huntington disease, hereditary chorea, then you have psychiatric symptoms as well as dementia due to basal ganglia degeneration. And here you can see the dopamine has increased, GABA has decreased, acetylcholine has also decreased, and also substance P has decreased. And also you need to know that the main problem is in the basal ganglia, especially the caudate nucleus and putamen. Now these areas are important because they normally control the movement by balancing dopamine and other neurotransmitters. So basal ganglia's primary control and role is that they have to make sure that the dopamine levels are in control. So they basically keep a close check of dopamine levels and other neurotransmitters. So obviously, when caudate nucleus and putamen will be damaged, what will happen? That these neurotransmitters are going to be fluctuating. So dopamine will increase and rest will decrease. Because of increased dopamine, so dopamine activity, what will happen? Excessive dopaminergic influence leads to excess movement, producing chorea, jerky movements. Right? And GABA normally inhibits movement, so when it is decreased and control movements occur. And acetylcholine also inhibits the motor activity. But if acetylcholine is decreased, then also jerky movements will increase. I hope that makes sense. So yes, also, you need to remember that in Parkinson's, the dopamine is less, but in Huntington, there's a lot of dopamine, which because of which there'll be excessive movement. So yeah, this is about it.